The last thing I want to talk about in this section are cardiovascular disorders. And I picked a few of them that are listed here and wanted to just give you kind of an idea of what they are. And one of the things that why we talk so much about cardiovascular disease is it says cardiovascular disease is a leading cause of early death in Western countries. It's responsible for more than 33% of all deaths. Now, part of the reason for this is that people are living longer, so they're more likely to have parts wearing out. And one of the things about cardiovascular disease and about heart issues in general is there's a lot we can do. There's a lot of ways to diagnose the conditions. We have all sorts of drugs and surgeries that can treat conditions. So we've made tremendous progress in treating cardiovascular disease over the years. And probably many of us will end up on drugs or get treatments related to cardiovascular disease. One of the things that this section here is talking about is just what are some of the things we can do to avoid having cardiovascular or heart disease in general or in particular. And, just talking about alcohol and what you can eat to make you less likely to have these conditions. So you can read that section if you're interested. The ones that I wanted to talk about, this is under disorders of the blood vessels. I already mentioned this term called hypertension, and it says it occurs when blood moves through arteries at a higher pressure than normal. So we know hypertension is just another name for high blood pressure. I already mentioned in a previous video that it's called a silent killer because you might not even detect it unless you have a heart attack or a stroke. I had mentioned before that high blood pressure is likely to burst capillaries because capillaries are so delicate, and we've got lots of capillaries in our kidneys. So high blood pressure can have a big impact on kidney failure. I actually had a friend in his 20s that woke up and he was kind of dizzy a couple times in a row. He was just kind of dizzy in the morning and didn't want to acknowledge it, and then even urinated and noticed that he had blood coming from his urine. And these were all signs of his high blood pressure that he had at a very young age. So it can happen to people of any ages. Usually it happens to people as they get older, but it can really happen at any time. High blood pressure, hypertension. The other talks a little bit about some of the drugs that you can use to lower blood pressure. And it says diuretics can cause kidneys to excrete more urine and getting rid of fluid. And that actually, reducing body fluid can help you reduce blood pressure just by reducing the amount of water in the body. Hypertension is often seen in individuals with atherosclerosis. And atherosclerosis is caused by the formation of these atherosclerotic plaques inside the blood vessels, and the plaques narrow the blood vessels. And so that's what this diagram is showing you, that if you get these plaques developing, and typically they're a result of certain kinds of fats, and cholesterol is in that category of lipids and fats. So they can accumulate in the blood vessels and therefore make the space, particularly in those arteries, smaller. And you can imagine if you make the space that the blood's flowing through smaller, the blood pressure is going to be higher. Though atherosclerosis can be influenced by diet and genetics, and can be a very serious complication of cardiovascular disease, or can be a very serious cardiovascular disease. Some other common cardiovascular diseases, there's one called a stroke, and I think all of us are familiar with the idea of a stroke, that somebody, they might start acting confused, or they might lose control of one side of their body. And what's happening with a stroke is, here it says a small cranial arteriole bursts or is blocked by an embolus, which is usually a blood clot. And so you block you have either the arteriole bursts or it's blocked, and therefore a certain part of the brain is going to be deprived of oxygen from the blood, and it can cause that part of the brain to die. And it could cause paralysis or even death in the person. So a person sometimes is forewarned by a stroke with a feeling of numbness in the hands and face, difficulty speaking, temporary blindness, and all of that depends on what part of the brain is being affected. So a stroke is a very serious and potentially fatal cardiovascular disease. Another one, heart attack or myocardial infarction, occurs when the heart muscle itself dies. And again, in an earlier video, I was showing you those coronary arteries, the arteries that are actually on the surface of the heart itself. And what happens is those arteries can be blocked by plaque, a lot of times by cholesterol. And if you pinch this off enough, the heart itself isn't getting enough oxygen and the heart itself is going to die. So that's what we call a heart attack. Now, a lot of you are familiar with the idea of bypass surgery. And so here's those coronary arteries, these red vessels. And they're saying if you have a blockage right here, so the blood's coming from here, going through here, and it gets blocked, here we go. Yeah, arteries away. If we have blocked arteries, what you can do is you can bypass that block by connecting the aorta directly to that artery. So instead of expecting the blood to go through there, you can go right from the aorta and go through here. And you can still deliver blood to this downstream of this blockage. So this is what we would call a bypass. This is a blood vessel. Usually they get the blood vessel from the arm or the leg of the patient, and they just sew in their very own blood vessels. And so this is something you would call a triple bypass, that they had 3 blockages in the heart, and so you sewed in 3 blood vessels. I've heard of as many as 5 bypasses, somebody getting them. But that's going to help keep the heart muscle itself alive if somebody happens to have blockages that could lead to a heart attack. I think the last one that I have on here is an aneurysm. And they don't have a picture of an aneurysm here, but it says it's a ballooning of a blood vessel. Most often the abdominal artery, or the arteries leading to the brain. What happens is your aorta comes off the heart, and then it goes all the way down your torso, and then branches into your legs. And so down all the way into your torso, that abdominal artery, which is actually the aorta, can get a weakened spot. And that just might be something that you were born with or you develop as you age. But you might get a weakened spot, and that vessel that has high pressure can get like a bulge in the side. And that can, if that bursts, you can imagine all that blood starts pouring out into your body cavity instead of being spread throughout your body. That can happen in your brain, it can happen in your body, and it requires absolutely immediate attention and is a very seriously, immediately life-threatening condition. So if somebody ever has a burst aneurysm, it's something that needs to be addressed immediately. The patient will not survive very long. Now, sometimes it's recognized that somebody has a bulge in their artery and it hasn't burst. And so depending on the situation, you may or may not get treatment to seal up that bulge. I know some of you might be familiar with Neil Young, the singer, and he had an aneurysm in his brain, and they sealed it up. They patched it up before it burst, and that happens frequently. And sometimes they say, nope, we're too worried about going near it. It could burst just from the surgery, and they just keep an eye on it, and you keep your fingers crossed. So there's all sorts of different cardiovascular conditions that we can treat and cause us all sorts of problems. But I'm going to end right there.